With only 45% of Americans fully vaccinated, health experts continue to be worried about the spread of a highly contagious Delta variant.
It is 60% more contagious than the Alpha variant, which was discovered in the UK.
UWL's Chief Quality Officer, Dr. Jeff Pothof, joining us in the studio. You have legs.
I do.
It's good to see you in person.
You bet. Good to be here, guys.
It's been a long journey since we started this journey. Where are we at right now?
You know, for those who are vaccinated, we're in a really good spot. So for vaccinated people, life really is getting back to normal, except for a few exceptions. So that feels good. I think, you know, early on we were worried about whether vaccination would get us back to normal or if we'd have to worry about transmitting to other people. It's good. You can go about your normal life if you're vaccinated.
Well, what about this Delta variant, though? We don't want to blow it out of proportion or concern people unnecessarily, but it is raising concern. How concerned are you about it?
Yeah, you know, I am concerned about the Delta variant for unvaccinated people. And the reason being, what you just said, it's much more contagious. You're more likely to get it if you come in contact with it. And it looks like it causes more severe disease, maybe even twice as likely to get you in the hospital as normal coronavirus. So that's a worrisome thing for those communities that have low vaccination rates or states with low vaccination rates. It may create hotspots of people who end up getting sick with this new variant.
But for emphasis, if you're fully vaccinated, you're okay.
Yeah, so you know, whether you got Moderna, Pfizer, or Johnson & Johnson, if you're fully vaccinated, you can hit the snooze button on the Delta variant. You're going to be okay. You're going to be protected. It really is an issue with those folks who are unvaccinated.
The Johnson & Johnson vaccine also protects you against the Delta variant. We got a question about that from one of our viewers. She wanted me to ask you this the next time you were on. She said she has blood cancer and immunosuppressive treatment. So does that mean she is not protected even though she is double vaccinated?
Yeah, so it doesn't necessarily mean that she's not protected, but people who have immunocompromised conditions, whether it's transplant patients, patients with cancer therapies, their immune systems don't always mount as robust a response. So those folks, that specific population, need to be a little bit careful because those numbers we've talked about, 90-some+% protected, likely doesn't apply to them. There's probably some protection there, but maybe not enough where they'd want to throw away their mask or avoid distancing.
It's unlikely we'll hit herd immunity, I would think, at this point.
Yep.
What does that mean? What does that show us?
Yeah, so the benefit of herd immunity, when you get those high numbers, 70%, 75%, it means that everyone's protected. So even if you are a cancer patient or a transplant patient or you just didn't get vaccinated, there's so much difficulty with that virus transmitting that everyone is afforded that benefit. When you're under that number, you still see benefit. You see less cases, but COVID-19 will still be around. There'll still be people getting that disease and enough people there that can continue to perpetuate its spread. So higher numbers are better. Hitting that 70-75% is the best.
Are we seeing the Delta variant in Wisconsin?
We do have Delta variant in Wisconsin. I think we'll continue to see more of it. We are also seeing it at maybe a little bit higher frequency in the Midwest. So something that we have to pay attention to as we go through summer and into fall is what % of our cases are Delta variant and what's that doing to some of these counties that are really not very highly vaccinated.
I mean, could this potentially cause another wave of COVID in the fall?
I think a wave, but not like the wave we had last fall, just because when we look at those folks who are most susceptible, the 65+, they're vaccinated at a very high rate. So it's unlikely that we'll see this big rush on hospitals with patients that need to be on ventilators and things like that. We might see little spikes in the hospital, but hopefully it should be something that we can manage within like our current hospital footprints.
And the flu season's coming up again. I was pretty much non-existent because we were all masked up. You see that as a problem as we start to go indoors in the fall?
Yeah, you know, I think as we get rid of the masks and we stop distancing, which is great, you will see the return of these other respiratory viruses, whether picking up a summer cold, which is certainly possible now, or a more robust flu season this fall. That's a possibility. I think it'll beg the question of, do some of us decide to wear a mask and to distance during those periods of time just so that we don't have to be sick for a week?
There'll probably be a flu shot in the fall again as well.
Yeah, absolutely.
Are we learning anything more now about the long haulers, now that we have some time under our belt with this?
Yeah, you know, we're learning more. So with viruses, we've always had a subset of people who've had these persistent symptoms, post-viral syndromes, what we call it. With COVID-19, it just seems to be happening a lot more often. And I think as we go forward, we're learning, you know, what are those symptoms? What are some treatments? Although I would say, you know, we don't have a pill or a therapy that fixes it yet. We are learning more. And if you are having long-haul COVID symptoms, it's a good idea to contact your primary care doctor who can help coordinate that care within some of our complex medical systems to get you the care that you need.
Doctor, good to see you in person.
It's so great to have you back.
Get vaccinated if you're not.
Yeah, absolutely. That is the trick.
All right, we'll be right back with the final check your forecast.